And then you have a choice, either you can proceed for emulsification or you can further chop. So if the pieces are free, you can simply pull them to the center and they will very naturally come to you, because there's already a vacuum which is pulling the free floating tissue towards it. And then you align the nucleus again so that the portion which you want to consume comes into your front. And now phacoemulsification, which is, if you are doing chop, is more like eating a pizza. So you have a pizza which you slice. You cannot eat whole of the pizza in one bite. So we slice it so that it fits our port. You can do phacoemulsification at the pupillary plane. It is safer there, but never very close to the endothelium, although some pieces may touch it. But if you are not rubbing the pieces over the endothelium, it doesn't matter. We have some amount of cortex left, rest is gone. रोशनी में देखिए. I always like to replenish my chamber with some visco to keep it formed, and also have a repeated coating of viscoelastic over the surface of endothelium. And that probably, I think that it protects my endothelium. बंद नहीं करिए, बंद नहीं करिए, दूसरी आंख खोलिए, बंद नहीं करिए आंख, सामने देखिए. Most of the cortex is gone. You have just some IOL.
भैया लेंस ओपन कर दीजिए, भैया लेंस खोल दीजिए.
So now there is no cortex left. There are some cells on the posterior capsule. I'm not bothered by that. It's a good. Will do it, or you can learn it now after the surgery, and next case you can do that. So learn the foot switch, how, what are the function of all the buttons. If you can learn it just now, fine. If you cannot, then take some time after the OT, ask sister, she will tell you. So this is like IA2. We don't want this. I want IA1. Now what is the vacuum right now?
Preset.
So we have set our vacuum. This is a peristaltic, this is a Venturi machine. So you cannot regulate the fluid flow. You can only regulate the vacuum. Do I make sense? नहीं, आप समझ रहे हैं मेरी बात? If it's a peristaltic machine, then you can control both the things, vacuum and flow rate. So when it is just Venturi, you cannot regulate the flow rate, you just have a control over vacuum. I prolonged that aspiration little longer because I was loving the noise it was making. And I was also looking for the authority of the sister, that whether people listen to her or not. And finally someone did pay response to her requests. So we will see that anterior chamber is well formed, and you flush the anterior chamber, and with the same jet you come out. So the increase in IOP will cause the valve to seal, and then you can touch the cornea